We tend to think of our heart as something that's hidden away, just quietly doing its job inside our chest. But what if it's actually trying to communicate with us? What if it sends out these subtle signals, little warnings that we can actually see on the outside of our bodies? Well, it turns out that's exactly what happens. From our eyes all the way down to our toes, our body can give us some pretty amazing clues about the health of our heart.
So that brings up a really interesting question, right? Can you actually get a hint about your heart's health just by looking in the mirror, without any fancy scans or lab tests? The answer, and this might surprise you, is very often yes. And learning how to read these signals is a really powerful first step in being more in tune with your own health. All right, so let's get right into it. For the next few minutes, think of this as a quick, hands-on guide. We're going to take a little tour of the human body, starting from the top and working our way down. And I'm going to show you exactly how to spot the signals your heart might be sending you.
So here's our game plan. First, we'll look at what your eyes might be telling you. Then we're going to zoom in on your fingers and nails. After that, we'll move down to check for clues on your legs, and I'll show you a really simple way to tell the difference between two common kinds of swelling, and then, most importantly, we'll talk about what to do with all this information. Okay, first up, the eyes. Now, I know it might sound a little strange to connect your eyelids to your heart, but believe it or not, they can actually give you an early heads up about a super common issue: high cholesterol. So what exactly are we looking for here? Well, if you ever notice these small kind of yellowish bumps on or around your eyelids, that's not just a random skin thing. Those are literal deposits of cholesterol. And here's the key takeaway. If you have so much extra cholesterol in your system that it's starting to show up on your skin, that's a huge visual clue that the same plaque building process could be happening inside your arteries. All right, next up, let's take a look at our hands. Your fingertips and your nails, they're surprisingly good storytellers about how well oxygen is moving through your body. Both the color and even the actual shape can tell you a lot. This slide shows the difference so clearly. A healthy sign is that nice pinkish tone in your nail beds. But there are two really important warning signs to watch for. One is a purplish or bluish tint. The other is a physical change where the nail actually starts to curve downwards, which is a condition called clubbing. So what's really going on here? So what's the story behind these signs? Well, that purplish color suggests the blood that's reaching your fingertips is low on oxygen. This can sometimes be a clue for certain types of congenital heart conditions. Now, clubbing, on the other hand, is usually a sign of a more long-term chronic lack of oxygen, which could be connected to either heart or lung issues. Moving on down the body, let's talk about the legs. It's really easy to forget that the arteries in our legs are all part of the same huge system as the ones in our heart. And when those arteries start to get narrow, our legs can show some very clear signs. So you want to be on the lookout for feet that seem pale or maybe feel numb a lot. Or maybe you notice the skin looks unusually shiny and that hair just doesn't seem to grow there anymore. These are all clues that the cells down in your legs aren't getting enough oxygen. And this is the most important part. Think of your circulatory system like one big highway. If you have blockages causing traffic jams in your legs, there's a pretty good chance the same thing is happening on the roads leading to your heart. Okay, let's tackle a really common sign, one that often gets people confused: swollen legs. A lot of folks just assume it's something like varicose veins, but it can also be a signal from a weak heart. So how in the world do you tell the difference? This chart breaks it down perfectly. First, look at the location. Swelling from a weak heart usually happens in both legs at the same time. With varicose veins, it's often just one leg, or at least one is way worse than the other. But the real giveaway is what I call the press test. If the swelling is heart-related, when you press on the skin, it'll leave a little indent that stays for a bit. If it's varicose veins, the skin usually just bounces right back. And this is a super simple test you can literally do right now. Seriously. Go ahead, sit down, and just use your thumb to press firmly on your shin for about 5 seconds. Now, let go and take a close look. If you see a little dent that hangs around for a few moments, that's called pitting edema, and it's definitely something you'll want to mention to your doctor. Okay, so spotting these signs is a huge first step, but step 2 is just as important: knowing what to do about what you found. And a massive part of that is knowing how to have a really clear, effective conversation with your doctor, especially when it comes to medications. Here's a real-world question that gets to the heart of a common problem. You know you need to be on a certain medication, but the side effects are just making you feel terrible. This is a classic situation where talking openly with your doctor is absolutely essential. So, what's your game plan? Well, first, there are simple things you can try, like always taking your meds after you eat. But the most important thing you can do is speak up. Don't just suffer through it. Tell your doctor exactly how you're feeling and ask that simple question: is there an alternative we could try? Remember, the best medicine on the planet is useless if the side effects make you stop taking it. Your treatment needs to be a partnership. So to bring this all together, here is a super simple checklist you can use every day. When you're standing in front of the mirror in the morning, just take an extra 5 seconds for a quick scan. Glance at your eyes, check out your nails, notice how your legs and feet look and feel. It is an incredibly simple habit that could give you a priceless early warning. You know, the biggest takeaway from all of this is that your body is constantly communicating with you. Our job is simply to learn how to listen. So the real question isn't just about what you've learned here, but what you're going to do with it. What's one small step you can take starting today to really tune in to what your heart is trying to tell you?